Hello and welcome back to my channel. I'm Miss Chocolate VSG, and this video will be about an update for my breast surgery and my arm surgery. I know it's been a long time, but I promised you guys that I was going to come forward with this video as my next video, so it took a while. However, with that being said, I still wasn't able to do the video editing that I wanted to do to blur out the particular areas that I wanted to blur out so you guys could see the actual procedure that went down. So I'm working on that. So what I've done to kind of compensate for that is put pictures in that I blotted out myself, and talk you through those pictures and let you know what was going on at that time. And as soon as I get the software that I need in order to blot out the areas that I need to be blotted out and posted online so that I'm not flagged and completely removed from YouTube, I will do that. But as promised, here is your video today. And I want to thank you guys for tuning in. I want to thank all of my new subscribers. Hello, and welcome to my channel. Um, I'm so happy for everybody that has subscribed. My numbers have tremendously inclined, and I'm so excited about it. And I hope that somebody out there is learning something. I hope that somebody out there is on their journey, and I am encouraging you guys to move forward and do what needs to be done in order to be successful on this journey. So, before I get started, if you are not following me on social media, Facebook and Instagram, you should because I post pictures. I try to post every week, before and after pictures of myself, of my journey. And I would love to have you guys aboard, the people that actually care about this journey, the people that actually care about weight loss and transformation journeys, on my page, so that you guys can bring in that positive that positive vibes and, to my social media page by liking and commenting. And yeah, so positive vibes, positive vibes. I hope everybody is doing well. I know that the world is going through so many changes right now, with COVID and with all the injustice and all of the riots and things like that. I pray that everybody is mentally okay, physically okay, and financially okay, and still able to go about their day to day things as normal. Um, my heart goes out to anybody that's struggling at this time, um, because it's such a hard time with COVID, with people losing their jobs, with people having to leave their jobs because it's not safe for their families. They don't feel like it's safe, or with just the things that we have to deal with, especially being African American in this world. And so, yeah, I'm praying for you guys, and I hope that you are praying for me. So let's get started. Okay, so as you guys may know, I had VSG, vertical sleeve surgery, back in 2017. And after I had VSG, I lost a total of 150 pounds before I had my first reconstructive surgery, which was a tummy tuck, a BBL, and 360 lipo. And that was back in March 2019. And here recently, in December 2019, I had arm surgery and a breast reconstructive surgery, or a breast lift. Um, so yeah, so I'm going to tell you today about how the procedure went, about what happened during the procedure, and I'm also going to explain to you the recovery of the procedure. And we're going to go into, depths about my scarring and, how I feel about it and how I feel out of my clothes and all of that stuff. So, since I can't insert the video of the actual surgery, I'm just going to be inserting pictures of the actual surgery so you can like follow the storyline. And so we'll do it like that. So first, when I went in for surgery, I kind of already knew what to expect for because I had the surgery in March, and I kind of wanted to do my surgeries back to back to back because um, surgery is such a hard thing to go through, and it's kind of like a bad relationship. Once you've went through it, you don't want to go through it. Like if you don't try again, like right then, you pretty much don't want to go through it again. So that was my take. It was like, oh, if I'm gonna be in this type of pain, I want to go ahead and get all the pain over with, and then just work on being free and free from the skin and free from everything and just move on and continue to move forward with my workouts and stuff like that. So that's just my personal opinion. So I did the surgeries, one in March, like I said, one in December. And so this is the last surgery that I had. So I'm going to insert a picture of what I looked like after the doctor drew up on me before surgery. And here it goes. So that is the markings that Dr. Pierce did on me before performing the actual surgery. And after I go back and look at that, I was like, wow, my tits were really low. And they were not like that before, I promise. They were so full and beautiful and, and just up there and just right. But after losing so much weight, that's what really happens to the body. And it's either you deal with that and you're okay with your, breast being saggy, or you're okay with just looking good in your clothes with a push-up bra or something that's able to help it, and that's fine. Because some people can't afford the surgery, and some people are just not, willing to do the surgery, because of whatever reasons, and I understand that. So, so before those of you who can and who are interested in it, and you're looking at this video, kind of wondering, how's the process? What do I need to expect? That's kind of like what to expect. So it kind of shocked me. Um, the next picture that I am going to show you is when Dr. Pierce is actually performing on my actual breast and on my arms. I'm also going to attach the picture of the of how he kind of like molded the breast, because I did not get implants. I wanted to be natural. I wanted to feel natural, and I did not want to have that, you know, that fake look per se. So I went the natural way. So with me going the natural way, Dr. Pierce kind of took some fatty tissue that from the breast that was hanging, and he kind of like formed it into a cup. So my breast is my breast, but my breast is constructed in a way to form that natural cone look. And so here is the picture for that. Okay, so on my arms, um, I kind of wanted him to like cut it down here and cut it on the side as well to pick up the back fat, and so that I wouldn't have any back fat, because um when you lose so much weight, the gravity of your skin and everything just drops on everywhere, all around the back, the your stomach, your breast, your arms, everything. So I kind of wanted him to, for the arms to like go down a little bit, like I think it's like right here, to pick up, the back fat and everything like that, and pull everything together. So that's what he did. So the cuts and incisions that I have, you might not, have. You might just, go here and, and just focus on your arms, and that's fine. But for me, the back fat really, really, really was a big issue for me. And so I wanted to get that taken care of too. So all at the same time, I went ahead and did that. And so I'm going to insert a picture of that. And I'm also going to insert a picture of the actual skin and all of the fat that Dr. Pierce took off of me. Here you go. So after coming out of the surgery, the surgery room and going into recovery, it was not as invasive as it was for the tummy tuck and the BBL, but however, it's still surgery, and you still have that moment of what the did I just do, you know. So um, I was in pain, but I was not in as much pain as I was before. I think I only spent 2 days in the hospital, and I was able to go home, and I did not have any drains. Like I did for the first procedure. I went home and my arms were wrapped, and my breasts were just free and out. The doctor did not want to put me into a faja for my arms or whatever because I got the breast done at the same time. And so he didn't want to like have it pressured down on the breast. So I got wraps for my arms until, my breast recovered in a way where I was able to put my, garment on. Um, yeah, it wasn't as an invasive as it was, but it was invasive. I did have pain. After surgery, also after taking a look at my breasts, I feel like, oh my God, all my breasts are gone. I feel so flat chested. And so I talked to the doctor about it. He was like, eventually everything will soften, everything will form out, don't worry. And it did. It softened out. I'm still like, you know, I got a little bit, I got a little bit. Look, see, I got a little bit. So it's not as big as they were before, but I am okay with it. Like I am okay with it. I am cool with it. It matches me now because my frame is so small now, and so it matches me. These are my arms, and as you can see, I have like a little bit, but it's not that bad. And you can see my scarring, and I am still working on my scarring. I am still working on um, I'll put down into the description bar what I use for my scarring because I know I get this question all the time, and I'm still using the same thing. I have not changed, and I expected the scarring under here to be a little darker, only because he pulled it really tight, and that caused like more scarring more than the actual cut because it was so much tension because I stressed the back fat that I did not want it. So, hey, I'm okay with the scars because I can cover it up with tattooing, or whatever I decide to do with that. The scarring on my tummy is not as bad. You can see it's not as bad um, right here. But hey, it's not as bad, but the scarring on my tummy is not as bad as my arms, but it is what it is. So the next picture that I'm going to show you is what I looked like after the surgery, and here it goes. Okay, so I have tried my best to explain the way my surgery went, to explain what happened to me during surgery, to give you all of the pictures and details as much as I could, without exposing my complete self on the video. So I hope this helps somebody out there that's looking forward to having surgery, or maybe you're on your weight loss journey now and you're just trying to, figure out in your head what you're going to need to do, if you're going to need to do anything at all, and if this is a route that you will be willing to take. I hope this video helped you in that way. And I pray everybody stays safe. I pray everybody is okay. Please leave me a comment, like, share, and subscribe to my channel if you are not already subscribed. I would love to have you. And thank you for watching. And positivity, love, and namaste.